As we first reported last week, the HIV outbreak that originated in Scott County is expanding to its neighboring counties. While the majority of the cases are in Scott County, there are now 5 in Jackson County. These rural health departments are struggling to get a handle on the outbreak. And as Barbara Harrington reports, the state is facing mounting criticism for not doing more.
The Jackson County Health Department sits in a small building in Seymour. It serves as a resource for residents to get information about public health risks in their community. But the one they're facing now caught the folks working here off guard.
HIV was not necessarily on the radar at that time. We knew we had drug users. The use of Opana and the sharing of needles was something that was in the back of everybody's minds, but we were not expecting the HIV turnout that we've had.
The State Department of Health says 5 people have tested positive for HIV in Jackson County, a big threat in a small rural community. But the local health department can only do so much to help combat the problem. They don't even have the resources to test people for HIV.
It costs a lot of money to set up a clinic and provide services to that population.
The state is expanding its efforts to quell the outbreak by providing resources for HIV testing to any community that wants them. Until now, their efforts have focused solely on Scott County, where they've set up a one-stop shop that offers free testing and clean needles. Jackson County hopes to start offering testing next week. While the cases discovered here have been contained, health officials say the outbreak still hasn't reached its peak.
As you've seen from our report from last week to this week, we've started to see a decreasing in that slope, and that is with our additional services on the ground, so we are very encouraged.
The majority of the cases are still being linked to IV drug use. In Jackson County, police say addiction is especially bad in the small town of Crothersville. It sits right across the county line from Austin, the epicenter of the outbreak.
Right now we are having a problem with IV drug use and probably the use of reusing needles and sharing needles, and that has been a problem with the Scott County events that they've had down there. It's kind of been a carryover into our county.
But police departments, too, are struggling to combat the root of the problem. Many are staffed at levels lower than what's suggested by the federal government.
Money would probably help for one, so we could have more overtime, more manpower.
The state is looking ahead to what its long-term response could look like. The Department of Health is working with doctors from the Centers for Disease Control and Prevention to determine what needs the HIV-positive population will have years from now and what resources small communities will need to address them.
It will have to include both providing care for people with HIV and hepatitis, helping people recover from drug addiction, and ultimately looking and trying to improve on some of the social determinants that have led this community to have such high rates of drug use.
We have the perfect storm of confluences of risk in one space. That is a community that has been does not have the resources associated with needs for substance abuse and addiction treatment services, mental health services. They exist here, but they are small.
That will have to change in order for the state and local health departments to truly get a handle on the HIV and hepatitis C problem. And people living in Austin are hopeful all of this attention will only make their community stronger.
The biggest fear is the negative response that, the public sees it as a negative thing, that other people around the world are seeing it as a negative thing. But as I said earlier, there's going to be so much positive come out of this. People know where Austin is now, and those resources are going to be made available. And when we call this at the state level or maybe even at the federal level and say, hey, we need help, we're from Austin, I think they're going to hear us, and I think they're going to provide that help.
Legislators approved a bill earlier this week that allows communities to ask for authority to set up needle exchange programs similar to the temporary exchange in Scott County. Reporter Barbara Harrington joins us now to talk more about the programs and Outbreak. Barbara, what communities would qualify for that needle exchange program?
Well, the bill that ultimately passed this week, it's a much more watered down version than what legislators were originally proposing. And the Republican governor and many Republican legislators were hesitant to support a statewide needle exchange, which was originally proposed. Now, the author of the bill, Ed Clear, says he considers what was passed a good compromise.
The bill doesn't go far enough for some. For others, it goes too far. And I hope that we have the right compromise here. I think we do. I know that the bill in front of you will benefit a number of communities who will take advantage of needle exchange.
Now, there's a long list of criteria that communities have to meet before they can even ask to have a needle exchange. They have to have either an epidemic of HIV or hepatitis C. They have to be able to prove that that epidemic is the result of intravenous drug use. And then they have to prove that the exchange is a medically appropriate response and that it's part of a larger comprehensive plan. After they do that, they even have to jump through some more hoops. They have to get the state health commissioner to declare a public health emergency before any of this can go forward.
Now, you mentioned that the state is expanding testing services to other counties. Is that only happening in the area of the outbreak?
They've said that they will expand testing to any community that wants help. They want people to get tested because if people aren't getting tested, it's hard to know how much of a handle they really have on this outbreak.
And we just have a few more seconds, though. Are health officials doing anything to try to get to those that are most risk?
They're targeting truckers specifically because prostitution is a problem in the area and they want to alert them to the outbreak.
Okay, thank you, Barbara.